In this video, we're going to talk about preeclampsia. And preeclampsia is a condition during pregnancy that occurs, and it's characterized with three major components. The pregnant woman will have high blood pressure, hypertension. She will have protein in her urine, proteinuria, and she will have significant swelling, edema. So these three things are the three fundamental things involved in preeclampsia. And if it progresses to seizures, then it's known as eclampsia without the pre, so just eclampsia. And this is most commonly occurs after 20 weeks of gestation, and it can progress. If untreated, it can be fatal. So that's obviously a very significant complication of pregnancy. Now, one thing that's very important that can also occur in preeclampsia is something called HELP syndrome. And this is commonly tested on the licensing exams. And the good news is that it's an acronym. The first H stands for hemolysis. The next two are for elevated liver function tests. And the last two letters are for low platelets. So if a woman comes in with a preeclampsia, and you check the labs, you check the peripheral smear, you check the AST, ALT, the liver enzymes, and you check the platelet count, and she does indeed have a hemolysis on the peripheral smear and elevated liver function tests and low platelets, then this is what has happened. So let's get into the symptoms, signs and symptoms of preeclampsia. I'll write that up here so we don't forget what we're talking about. Well, the most significant physical exam finding is significant edema and resultant excessive weight gain because of the excessive fluid. The edema will be quite troublesome to the pregnant woman. It'll be facial and hand swelling that is quite significant. And if this progresses to any of the following, then it's considered severe preeclampsia. So this is preeclampsia, the edema. But if you have any of the following things that I'm going to talk about, then it's severe preeclampsia. And what are those things? Well, the things that would make it severe are as follows. Any sign of organ damage, so for example headache, visual disturbances, confusion, abdominal pain, nausea or vomiting, difficulty breathing. If the pregnant patient has any of these, then it's considered severe preeclampsia. Now, the signs, of course, which are high blood pressure and proteinuria, you will of course measure. The blood pressure, of course, you will measure, and the proteinuria you will be able to detect during diagnostic testing. So we already noticed that the patient has significant edema. Now we will check the blood pressure, and it will be elevated. It will be hypertensive. That's the second component. And then of course the third component is proteinuria. So in order to diagnose this, you have to do a 24-hour urine collection, and that will show greater than 300 milligrams of protein in a 24-hour period in the urine, and that will clinch the diagnosis. Other diagnostic tests that you will do include a CBC. If you remember the HELP syndrome, peripheral smear, and the comprehensive metabolic panel. The CBC will show you the platelet count, and if the platelets are low, then that's part of HELP syndrome. The peripheral smear will show you if there's any hemolysis, and that's the first H. The CMP will show you the AST and the ALT, which are the liver enzymes, and if they're elevated, that will be part of health syndrome as well. So this was the diagnostic testing. So what is the treatment? Well, the definitive treatment for preeclampsia is delivery. And this is possible if the pregnancy is greater than or equal to 37 weeks. You are also recommended to deliver the baby if it's greater than 32 weeks if you have severe preeclampsia. The next part of treatment is seizure prophylaxis. Because remember, if preeclampsia progresses to eclampsia, that means that seizures have occurred. And seizure prophylaxis is done with a very important drug, magnesium sulfate. And please remember that for your licensing exams. And magnesium sulfate must be given to stop or prevent seizures from occurring. So I just want to, before I go to some clinical vignettes, I'd like to just go over some of the key points. So preeclampsia is when a pregnancy that is greater than 20 weeks gestation results in high blood pressure, significant edema, and proteinuria, protein in the urine. Eclampsia is when this progresses to seizures. HELP syndrome, which is hemolysis, elevated liver function tests, and low platelets, can occur in about 10 to 20% of cases. And the definitive treatment involves delivery and magnesium sulfate for seizure prophylaxis. So let's look at some clinical vignettes. A 26-year-old African-American woman presents into emergency department where you are working. She is 37 weeks pregnant and is complaining of severe headache for the past 24 hours. She also tells you that she has noticed that the vision in her right eye has been extremely blurry. She states that her pregnancy has been uneventful and that she receives prenatal care at the hospital. The card she is carrying with her indicates that all prenatal tests were within normal limits. 3 consecutive blood pressure readings, 15 minutes apart, are 156, 164, and 144. The nurse informs you that her bedside urine dipstick reveals 3+ proteinuria. On physical exam, you find a mild systolic ejection murmur and 2+ pitting edema of her lower extremities. A sterile vaginal exam reveals a long and closed cervix. Tocodynamometer shows irregular uterine contractions every 8 to 10 minutes. The external fetal heart tracing is reassuring. The most appropriate next step in this patient's management is, well, she's got all 3 classic symptoms or signs of a preeclampsia. She's got the edema, she's got the proteinuria, and then she's got the high blood pressure. So she's definitely she definitely has preeclampsia, and she is 37 weeks, so she can definitely be a candidate for delivery. So to deliver is the appropriate treatment, and then you want to give magnesium sulfate to prevent seizures from occurring, seizure prophylaxis, and that would be choice B. One more. A 25-year-old nulliparous woman at 35 weeks gestation comes to the labor and delivery ward complaining of contractions, a headache, and flashes of light in front of her eyes. Her pregnancy has been uncomplicated except for an episode of first trimester bleeding that completely resolved. She has no medical problems. Temperature is normal. Blood pressure is 160/110. Pulse is 88, respirations are 12. Exam shows that her cervix is 2 centimeters dilated and 75% effaced, and that she is contracting every 2 minutes. Fetal heart rate tracing is in the 140s, and reactive urine analysis shows 3 plus proteinuria. Lab values show leukocytes 9,400, hematocrit 35%, platelets 101, AST 200, ALT 300. Which of the following is the most appropriate next step in management? Well, this is very interesting because she has, well, to me it looks like she's got HELLP syndrome. Well, she definitely has preeclampsia because she's got the elevated blood pressure and then she's got the proteinuria. But it looks like from the lab tests she's got elevated liver enzymes, and the platelet count looks a bit low as well. So she definitely has preeclampsia, and then she's got this special complication of preeclampsia known as HELLP syndrome. So what is the management? Well, the management in the severe, I'd actually put her in the category of severe preeclampsia, is definitely delivery and giving magnesium sulfate to prevent seizures. So that would be choice D.